As a physician, my primary goal in treating patients is to help them achieve a healthy and happy life. As a specialist in pain management, I have a secondary goal to help patients try and achieve a pain-free or at least relatively pain-free life. As a graduating medical student, I took the Hippocratic Oath. One of the promises within the oath is to first do no harm. That has always been a guiding principle for me when I weigh the treatment options for all of my patients. As I'm thinking of ways to help my patients deal with their pain and the anxiety associated with pain, I always try to focus on the most effective and least risky way to accomplish that goal. Unfortunately, that is not always as easy as I would like it to be. There are some pharmaceutical drugs that can help reduce a patient's pain, but they also come with proven and known side effects. Most people are very familiar with the dangers of using opioids for chronic pain. There's always the possibility of addiction and the numerous problems associated with that. There's the problem of increased tolerance, where we have to continually increase the dose of the pain medication to achieve the desired effect. Unfortunately, there comes a point where the increased dose will cause extremely serious side effects, including the possibility of death. Once again, I'm reminded of my promise to first do no harm. As a pain management physician, I'm forced to walk the fine line between helping relieve my patient's suffering and at the same time doing harm with the medications I prescribe. Another class of pharmaceutical drugs that is commonly prescribed for pain patients are the benzodiazepines, such as Valium and Xanax. Oftentimes, these drugs are used to help try and treat the anxiety that so often accompanies chronic pain and the fear that pain will never go away. Once again, these medications are not without significant side effects, and when used in conjunction with opioids, can be extremely dangerous. What would the ideal drug look like? Based on the above facts, one can easily see the perfect drug would be one that has the potential to not only control pain, but also the potential to heal the disease rather than just mask the symptoms. In addition to the pain-relieving qualities, that drug would also help patients manage their anxiety and depression that is so often associated with the pain. Lastly, that drug would have the ability to do these things without the harmful side effects. That is precisely why I'm very excited about the potential of cannabidiol, also known as CBD. Although it is too early to call it the perfect drug, I believe it has significant potential to completely disrupt traditional ways of treating pain, anxiety, and many other diseases without the dangerous effects associated with the current pharmaceutical drugs. Cannabidiol is a natural extract from the cannabis plant. The natural healing powers of CBD have been used for thousands of years. Please don't confuse CBD with medical marijuana. I've made another video entitled The Facts About CBD versus Medical Marijuana to provide more information about the differences. CBD is considered a nutraceutical, which means it's considered a standardized nutrient by the FDA. It has also been proven to be extremely safe. It is not a prescription pharmaceutical drug. To date, the vast majority of the research done on CBD has been in preclinical trials. A preclinical trial is a study using an animal model. The goal of the preclinical trial is first to collect information on the safety and second, potential benefits of the drug. Preclinical trials are required before any clinical trial in humans can be started. I've attached a link to a few of the preclinical trials that have been done over the past several years. There have been numerous preclinical trials showing that CBD is safe and has numerous anti-inflammatory effects. These anti-inflammatory effects can decrease pain by preventing the release of many of the pro-inflammatory chemicals that occur at the site of an injury. These pro-inflammatory chemicals have been shown to increase abnormal pain signals that can lead to the chronic pain cycle. You may ask, why is this property of CBD so important in regards to helping cure and treat many disease processes? Our bodies use a very important and powerful mechanism to fight off foreign pathogens such as viruses and bacteria. This mechanism also helps initiate tissue repair, However, there are times when this process does not turn off appropriately or it becomes excessive. When the process of oxidative stress does not turn off appropriately or is in excess, it can lead to further oxidative stress, inflammation, and that inflammation can cause tissue damage and dysfunction. There are many diseases associated with oxidative stress and inflammation. These include diseases such as atherosclerosis, Alzheimer's, diabetes, rheumatoid arthritis, cardiovascular disease, chronic inflammation, and pain, as well as neuropathic pain. Can CBD really help all of these different diseases? According to a significant amount of preclinical research done already, the answer is yes. There are many clinical trials currently underway to confirm that answer. As a physician who tries to help people manage their pain and suffering, I'm extremely excited to have a new, safe, and effective way to help. I look forward to working with you to help you live a wonderful and pain-free life.